A critical thinking approach to mental health NCLEX success. Hello everyone and welcome to your #1 NCLEX map. Today, we journey through the dynamic landscape of mental health nursing, sharpening our critical thinking through 25 carefully crafted NCLEX-style questions. These aren't just test questions, they're real-life scenarios, demanding the kind of clinical judgment that defines safe and effective nursing practice. Let's begin. Question 1. A nurse is caring for a client with major depressive disorder who says, "I just want the pain to stop." What is the nurse's priority response? A. Are you thinking of hurting yourself? B. Let's talk about what's making you feel this way. C. Many people feel this way sometimes. D. Try to stay positive. Things will improve. Correct answer is a rationale. This is a classic case of therapeutic prioritization. The client's statement suggests passive suicidal ideation. According to the Joint Commission and ANA standards, the priority is assessing safety. Direct, non-judgmental inquiry about suicide is evidence-based and does not increase risk. In fact, it opens the door for intervention. Question 2. Which client behavior most strongly indicates a risk for violence? A. Avoiding eye contact. B. Pacing and clenched fists. C. Flat affect. D. Repeating the same phrases. Correct answer is B. Irrationale. Pacing and clenched fists are signs of mounting agitation. The National Institute of Mental Health notes that behavioral cues like these precede violent outbursts. Early identification allows for de-escalation, a critical nursing intervention. Question 3. A client with schizophrenia tells the nurse, "The FBI planted a chip in my brain." What is the best response? A. There's no chip. That's not true. B. That must be frightening. You're safe here. C. Why do you think that? D. Let's not focus on that right now. Correct answer is B. Irrationale. Delusions should not be challenged directly, as this increases defensiveness. Therapeutic communication requires validating the emotion without reinforcing the delusion. This aligns with psychiatric nursing best practices and trauma-informed care. Question 4. Which medication requires monitoring for agranulocytosis? A. Risperidone. B. Haloperidol. C. Clozapine. D. Olanzapine. Correct answer is C. Irrationale. Clozapine, though effective in treatment-resistant schizophrenia, carries a black box warning for agranulocytosis. The FDA mandates regular WBC and ANC monitoring due to the risk of life-threatening infection. Question 5. The nurse observes a client with OCD repeatedly washing their hands. What is the most therapeutic action? A. Interrupt the behavior and redirect. B. Allow time for rituals, then discuss feelings. C. Set strict limits on rituals. D. Provide distraction with group activity. Correct answer is B. Irrationale. OCD rituals serve to relieve anxiety. Sudden interruption can escalate distress. CBT-informed care encourages the nurse to respect the need initially, then gently explore underlying anxiety and promote adaptive coping. Question 6. Which outcome is most appropriate for a client with generalized anxiety disorder? A. Client will be free of all anxiety. B. Client will verbalize reduced worry to manageable levels. C. Client will avoid stressful situations. D. Client will require no medication. Correct answer is B. Irrationale. Realistic, measurable goals are key. Anxiety can't always be eliminated, but managing it is possible. This reflects smart outcome writing and promotes long-term emotional resilience. Question 7. A client admitted for alcohol withdrawal has a BP of 168/104, tremors, and hallucinations. What is the priority action? A. Reorient the client. B. Give lorazepam as prescribed. C. Notify security. D. Offer fluid. Correct answer. B. Rationale. These are signs of delirium tremens, a medical emergency. Benzodiazepines like lorazepam are first line to prevent seizures and stabilize the CNS, as endorsed by the American Society of Addiction Medicine. Question 8. What dietary restriction is essential for clients taking phenelzine? A. High protein. B. Low fat. C. Tyramine free. D. Gluten-free. Correct answer is C. Irrational. MAOIs like phenelzine interact dangerously with tyramine-rich foods, aged cheese, wine, risking hypertensive crisis. This knowledge is crucial for safe dietary teaching and patient safety. Question 9. Which finding indicates serotonin syndrome? A. Muscle rigidity and high fever. B. Dry mouth and blurred vision. C. Bradycardia and hypotension. D. Slow reflexes and sedation. Correct answer is irrational. SSRIs, especially when combined with other serotonergic agents, can cause this life-threatening condition. Key signs include hyperreflexia, tremor, fever, confusion. Prompt discontinuation and emergency care are essential. Question 10. A client states, "I'm worthless." What's the best therapeutic response? A. Everyone has value. B. Tell me more about why you feel that way. C. You shouldn't think like that. D. Try to be more positive. Correct answer is B. Irrational. Empathy and exploration are therapeutic. Open-ended questions foster trust and deepen assessment. According to motivational interviewing principles, understanding client perspective precedes change. Let's keep going, because each question builds your clinical sharpness. Question 11. A nurse notices a client with PTSD avoids group activities. What is the best initial response? A. Encourage them to try anyway. B. Respect their space and assess further. C. Remind them of the benefits. D. Report non-compliance. Correct answer is B. Irrational. Trauma-informed care honors client autonomy. Avoidance is a hallmark of PTSD. Forcing participation early may re-traumatize. Building trust is the first step. Question 12. A client with borderline personality disorder threatens to self-harm after staff change. What is the priority intervention? A. Call the provider. B. Enforce boundaries and provide support. C. Ignore the behavior. D. Change the staff assignment. Correct answer is B. Irrational. Clients with BPD struggle with abandonment and use manipulative behaviors to regain control. Firm, empathetic boundaries and validation reduce risk and model healthy coping. Question 13. Which behavior is expected in manic phase of bipolar disorder? A. Withdrawn affect. B. Slow response. C. Grandiosity and rapid speech. D. Excessive sleep. Correct answer is C. Irrational. Mania presents with inflated self-esteem, pressured speech, and decreased need for sleep. These symptoms impair judgment and may lead to risky behavior, requiring prompt intervention. Question 14. Which is a priority nursing diagnosis for a client with anorexia nervosa? A. Disturbed body image. B. Imbalanced nutrition. Less than body requirements. C. Ineffective coping. D. Powerlessness. Correct answer is B. Irrational. Physical stability comes first. Malnutrition can lead to cardiac arrhythmias and death. Nursing diagnoses should always reflect Maslow's hierarchy, prioritizing physiological needs. Question 15. A nurse is teaching about ECT. Which statement indicates understanding? A. It causes permanent memory loss. B. It's only used as a last resort. C. Short-term memory loss is common but improves. D. It works slowly like antidepressants. Correct answer is C. Irrational. ECT is rapid-acting, especially for severe depression and suicidality. Short-term memory loss is expected but typically resolves. It's not last resort anymore. Modern psychiatry considers it frontline for some cases. Question 16. What's the first step into escalating an agitated client? A. Use restraints. B. Offer PRN medication. C. Speak calmly and reduce stimuli. D. Move other clients away. Correct answer is C. Irrational. Verbal de-escalation is always the first-line intervention. According to SAMHSA, a calm tone and non-threatening posture often prevent violence and protect everyone's dignity. Question 17. Which is a positive symptom of schizophrenia? A. Apathy. B. Hallucinations. C. Flat affect. D. Anhedonia. Correct answer is B. Irrational. Positive symptoms add to baseline functioning, hallucinations, delusions, disorganized speech. Negative symptoms subtract, like effect blunting. Distinguishing the two guides medication management. Question 18. A client on lithium reports nausea and tremors. What should the nurse do? A. Hold the dose and notify the provider. B. Tell them it's expected. C. Encourage hydration and rest. D. Give with food and reassess later. Correct answers. The rationale. These are signs of lithium toxicity, especially when accompanied by GI upset and coarse tremors. Lithium has a narrow therapeutic index. Early action prevents severe neurotoxicity. Question 19. What is an early sign of escalating agitation? A. Silence. B. Confusion. C. Loud voice and pacing. D. Crying. Correct answer is C. Rationale. Behavioral cues precede aggression. Monitoring tone, volume, and movement helps intervene early. Crisis prevention models emphasize these signs for timely action. Question 20. Which intervention helps prevent relapse in schizophrenia? A. Encouraging isolation. B. Skipping doses when feeling better. C. Involving family in education. D. Discontinuing meds after 6 months. Correct answer is C. Rationale. Psychoeducation reduces rehospitalization. Families who understand the illness offer better support. This aligns with evidence from NAMI and WHO. Question 21. What is the priority during a panic attack? A. Explain the causes of anxiety. B. Offer reassurance and stay present. C. Teach deep breathing techniques. D. Refer to counseling. Correct answer is B. Rationale. During panic, cognition is impaired. Grounding and presence reduce fear. Skills teaching comes after symptoms subside. Question 22. Which finding suggests a child may be experiencing abuse? A. Wears same clothes often. B. Says, I fell down again, with bruises. C. Poor appetite. D. Refuses to speak. Correct answer is B. Rationale. Inconsistent explanations for injuries raise red flags. Mandated reporting is legally required and ethically critical. Question 23. What is a therapeutic goal in group therapy for addiction? A. Learning to avoid all triggers. B. Sharing experiences without judgment. C. Developing physical health. D. Gaining employment. Correct answer is B. Rationale. Peer support fosters accountability and self-understanding. Group cohesion is a healing force, supported by 12-step models and evidence-based group psychotherapy. Question 24. Which is a sign of neuroleptic malignant syndrome? A. Sweating, muscle rigidity, and fever. B. Sedation and drooling. C. Tremor and bradykinesia. D. Weight gain and hunger. Correct answer is a rationale. NMS is a medical emergency from antipsychotics. It mimics serotonin syndrome but with lead pipe rigidity. Immediate discontinuation and supportive care are life-saving. Question 25. What shows effective coping in a client with chronic mental illness? A. Denial of symptoms. B. Frequent ED visits. C. Seeking support and adhering to treatment. D. Avoiding discussion of illness. Correct answer. C. Rationale. Acceptance and proactive behaviors indicate growth. Mental health recovery is about empowerment, not perfection.